welcome back to another edition of Hart2Heart Podcast. And my guest today is Dr. Anna Sylwestrowicz. She's the owner of the Dr. Anna Clinic, and she's an anesthesiologist. Welcome to the show.
Thank you, Mike. Thank you for inviting me, and thanks for the opportunity.
Yeah, so I've been following you on social media now for a while. I feel like, a lot of our views are really aligned. And, I do want to commend you again for, speaking out for, on various different things. I think you're providing a lot of good information online. But also, though, too, a lot of the listeners to this podcast, they really appreciate doctors who take care of themselves. And you're a doctor who takes care of yourself. Like, it's very, very clear. If you look at your Instagram, obviously you're super fit. You obviously take great care of your skin and other things. So, before I get into all of the questions, I just want to maybe get to know you a little bit more. And, this kind of helps me. So can you kind of just go through like your 24-hour routine, like what you do when you get up until you go to bed, maybe include in there, don't you have to be like too personal, but just include like, when you get up, go to bed, your supplements, if you take any drugs, like, pharmaceutical drugs. I'm not talking about recreational drugs, that kind of thing. Just kind of take us through like your 24-hour routine.
Okay. So, as you know, our healthcare is sometimes it's hard to access, right? And I think people need to take personal responsibility, and that includes doctors. When we say and we complain, oh, we're so overwhelmed or whatever, well, we have to make the changes that we need to make in order to stay healthy. So this year I'll be turning 57, and I've been a medical doctor for 33 years, and I decided that I just don't want to practice in a system where I don't feel healthy. I don't feel valued. I don't feel respected. And, as a female as well in medicine, I always found it was always like a little bit of a boys' club in my hospital. So I decided in about 2016 or 17 that I've had enough and I am going to start looking after myself. And that means I always was active. I've always tried to incorporate exercise into my day. But it was one of those things where I ran a lot. I ran, half marathons. I was always running. I was the neighbors used to laugh, oh, there she goes again. Or I'd cycle to work and trying to get my exercise in. But it was more because it was a way of managing my stress. Now I don't nearly exercise, like that, but I definitely manage my stress a lot better than I used to. So in my own clinic, I can set my hours, I can decide who to surround myself with and how I want to spend my day. And so I set my hours, I start at 10 o'clock in the morning. So in the morning, every single morning, I get a short workout in. And if I can't, often I will walk. I always walk to work, so it takes me about 20 minutes. It's rare that I drive a car these days. It's too close to ride a bike, but my husband introduced me into a little bit of weight training, resistance training. I think that is very important for women. And no, you're not going to bulk up. You're going to just maintain muscle mass, prevent sarcopenia, maintain healthy bones. And everybody's looking for a quick fix, They just want that cream or something to rub on that's going to fix everything magically. And I'm trying to tell my 5 kids who never listen to me the importance of daily habits. They don't. They won't listen. They'll have to do. One was particularly challenging for me. If curfew was midnight, he'd have to come in at 1 a.m. So
hey, but my parents don't listen to me though too. So it goes both ways. Although I shouldn't say that.
So my father is 87 this year, and okay. I'm trying to tell them the importance of resistance training. Do you think they're going to do it? No, they're not. They're not going to do it, but they are very active and they do swim. And so at both ends, they're not listening. But, everything, I think we follow very similar people on social media and doctors that are really trying to educate and make a difference. And a lot of it starts with self-care and self-responsibility. And so that is creating healthy lifestyle habits, sleeping, nutrition, exercise. And there are a million influencers out there that'll tell you, this is the right diet or that's the right diet. Doesn't really matter. The issue is you have to get movement in. You have to learn how to manage your stress. You have to enjoy your work environment. you have to be in a healthy relationship or not in one. But if something is really dragging you down, it's not that there's a problem with you. It might be just your environment. It might be a toxic work situation, a bad marriage, issues, right?
I totally agree. I mean, we will get into like some psychotropic drugs, and their overuse really, a little bit later. But I, completely agree with you. If you want to fix someone, you need to fix their life, right? So you need to fix like what's going wrong. So if your relationships are really, really poor, then, obviously that's going to affect your life. If your career is not going so well, that's going to affect your life. If your health is really poor, that's going to affect your life. And I kind of put those three as like the big three. But you sort of need to understand that there's never going to be one thing, like one supplement or one drug or one visit with one therapist, and now like I'm even an enthusiast of psychedelics, but like this thing that like you're going to have one like ayahuasca experience and then your life is going to change.
And
it's
ridiculous. Magically sort everything out for you, right?
Yeah.
And I think my motto is always first do no harm. So even in cosmetic medicine, nobody's forced into anything. So it's not going away. The lasers aren't going away. People get Botox. And the important thing is, full informed consent, knowing that people that are coming into the clinic are quite vulnerable and they often have fairly low self-esteem. Like why, they're getting things done because they want to fix something, right? And then we get into, because I'm in a position of privilege now in that I can spend the time with them, I actually do take a full medical history and I do talk to them about their lifestyle habits, which a lot of people have unbelievable stressors and they don't know quite how to manage that. And so I'll give you an example of even one of the doctor's wives that comes to see me. And, her husband's a surgeon and it's stressful because she's parenting all on her own. He's
How
never
many
around.
kids?
4 children.
Oh, wow. That's a lot.
Yeah. And never around. And so I said, what one thing could you change? What is the one thing that's just drowning you? And she said laundry. And so we organized something to get her some help with laundry on a Friday. And it was life-changing. Sometimes it's not, it's such a little thing, but because you're taking the responsibility of being in charge of the household and looking after things, you think you have to do everything yourself, right? And
I'm a big fan of outsourcing. I really think that if you can afford it and if it's within your means, like outsourcing things can really relieve a lot of stress. And I think it is, underappreciated and probably something that more people should have done. And I mean, this lady in her instance, if her, husband is a surgeon, clearly he could afford it and they could have done this before now and sorted it out. But I also wonder too, in a situation like that, like if there's like a lack of like connection, I feel like that's always a thing that sort of like breaks apart in relationships when there's a lot of things that are added to it, such as kids, such as a stressful job, is that, people don't have as much time for themselves and to make that connection.
I can tell you right now, a lot of my patients are physicians and they're drowning and decisions are being made for them to practice medicine in a certain way. And people that are making the positions, the higher ups, maybe don't even have a medical background. And it's frustrating. And, they feel like all they're doing is stamping out fires and writing prescriptions and following protocols and policies. We're so top heavy with things. And I'll just give you one example of before I was still working in the hospital, we wanted to implement the World Health Organization guidelines for the surgical safety checklist. That thing where you mark the kidney so you make sure you don't operate on the wrong hip or take out the wrong kidney, right?
Right.
So that took 20 meetings with 8 people. Why does everything have to be so complicated? Why can't we just start using a little bit of common sense and saying, okay, why are we reinventing the wheel? This has been implemented already, right?
Yeah.
Why do we not look at how other provinces are doing it or how other countries do certain things and just make an executive decision and say, hey, we're going to do that?
Yeah, I don't understand either. And like one thing that really points out to me, and this would affect, everyone almost worldwide, is like the RDA for protein intake. It's something like 0.36 grams per pound, which is not enough to,
It's not
preserve,
enough. Yeah.
muscle loss when you're older. And like, again, like, why is that recommendation still there? Like, that it's wrong. I know that it's wrong. Most people listening to this know that it's wrong, yet it's still being recommended. Like, it just doesn't make any sense.
I just think everything, so many recommendations and so many of our problems arise from regulators and how recommendations are made in the first place. And if you look at, who regulates food and drugs and big food and big pharma, and it's our Health Canada and FDA. And how do these products even get on the market? Why aren't they marked? We took the time to mark every single cigarette and it's got a little label, right? So my troublemaker kids were like, oh, hey, we're going to get a couple of packs of those. That's really cool. Look at that. They've got little labels. Like, I don't know. Did that really help, having a little label on every cigarette? And yet we don't label highly ultra processed foods.
Yeah.
All that crap that's on the middle aisles of the grocery stores, the Fruit Loops and the sugary cereals and
that stuff being promoted now in some cases. Like I'm not sure what organization came out, but there was some kind of mainstream food organization, something that came out maybe 3 to 4 months ago that said that you can have a processed food diet. Basically, they said like up to 90% of your diet can be in processed food, and that would essentially be okay. Was what they were trying to say in the messaging, which is insane, and it's hilarious.
You were asking me about my habits. What I've changed as well is that I will do a big grocery shop maybe once a week or every 2 weeks. But because I walk to work and I walk back home, I will usually stop at our local Old Farm Market grocery store and pick up fresh produce, which is usually local. The meat there is organic. It's island raised. Amazing. Without hormones and antibiotics. And it's really not more expensive to buy local produce than it is to buy produce at bigger grocery stores.
Yeah, you can find some really good deals. Like I like beef jerky, but again, finding really good beef jerky is sort of difficult. But there's been some companies that I found online recently where it's actually pretty reasonable and it's all grass fed, no like
the South African biltong.
Yeah, yeah, exactly. And and it builds those masseter muscles. So it's good for the guys who want to really get the
and then there's Asian girls that want to have a very narrow face and they get masseters injected with Botox.
Oh, wow. I didn't know that. I know that I've seen though guys, there's like something called like a jaw sizer, I think it's called. So I guess if you just chew
Andrew Huberman, the chewing thing, right?
Yeah. I don't know if that one's fake though. If someone told me that that's actually fake, it's not actually him advertising that. And he's had like a lot of issues, as like a lot of people have, with people using AI to promote stuff. So I don't know if he actually promoted that or not, but I know the clip that you're talking about. So it kind of be interesting to see if that is, him or not. You said something earlier though that I sort of wanted to talk about, because you said a lot of your patients are doctors. And so, why do you think that is? And what are these doctors coming in for?
I believe in my past life as an anesthesiologist, I think I was respected, and all my issues started trying to do a business in medicine in Canada, because as you know, the Canada Health Act, it's next to impossible unless you're doing things that are not covered by medical services plans, so cosmetics or maybe platelet-rich plasma, but then even the people that do pain medicine, they want to keep that to themselves. And the dermatologists want to keep the lasers to themselves. And everything is, this is in your scope of practice and that's in your scope of practice, without looking at, we can learn a lot of stuff and use the knowledge that we've had in the past. So in my career, I managed a lot of diabetics. And I think doctors are coming in because a lot of them don't have access to care themselves. in my family, out of the 9 of us, only 2 have access to a regular doctor. So that is what's happening in BC. And in this clinic, a lot of the retired people that came from other provinces as well don't have family doctors. So, you get a reputation as being a reasonably ethical person who can still write a prescription until they take that away. Maybe they will. But, here in BC, we're allowing caseworkers and nurse practitioners, nurses to do a lot of the things that doctors do. It's now in their scope of practice. So times are changing. Naturopaths can do practically anything we can do. And I noticed that one of the mainland Allergan trainers is actually training naturopaths how to inject Juvederm and Botox. So
yeah, I mean, that's an interesting point, actually, because like our scope of practice is sort of being continuously limited to some degree. And then these other alternative practitioners, like naturopaths, is being expanded. So, if you take away limit the scope of practice of someone, say, to prescribe a certain drug, and now, naturopaths are able to prescribe that drug. And I think now they can prescribe like hormones and stuff as well in certain provinces.
And pharmacists as well.
Okay.
And, I tweaked to the fact that we have some issues. If pharmacists are willing to send you away to Miami to learn more how to prescribe certain things in order to prescribe more of that stuff, we have some serious issues to discuss and conflicts of interest. And like you say, our scope, here I am, an anesthesiologist who was a family doctor at first and then anesthesia and practiced. And the scope of practice is being narrowed and narrowed and narrowed. And caseworkers in the community are injecting antipsychotics to people. Like, none of it makes sense to me. And naturopaths can do everything I can do, write prescriptions for lumbrokinase for protein CNS deficiency. That's earthworm extract, by the way. And none of that makes sense either. And it seems they're allowed to get away with all of this, right?
Yeah, it does seem like that's happening. And it does seem like in some ways like we're being pushed out, and sort of narrowed into just one scope. This is what they want us to do. And, I feel like that in some regard where, I mostly work in a walk-in clinic now. And, the reason that I, like working there to some degree is the fact that it just seems like I'm not going to get in trouble there. You know what I mean? Because I'm just basically doing the most basic thing that I've been trained to do as a family doctor is, to do family medicine work in a family medicine clinic in a walk-in setting. Like that's exactly what I'm, designed and trained to do. So I'm not going outside my, scope of practice whatsoever.
Yeah. And, in anesthesia, I was a pediatric trauma. I did a lot of peds trauma and used my hands a lot, did all sorts of things. And anesthesiologists and emergency doctors, really, the scope of practice is pretty broad. And the pharma influence in both those specialties is pretty limited. Same with intensive care medicine, right? And yet some specialties are unbelievably pharma funded. And when I actually dug deeper over the last 3 years, because my husband laughs that, I just get bored easily. So I'll go in there and I'll be researching the clinical trials and looking at it. It's so disappointing, some of the medical research that's out there. And if people can't see, or maybe they've never even looked, that it's, entirely pharma funded, so much of it is ghostwritten if you actually look closely. And, all the reps that come to your office to show you, Rexalti or whatever, right? And the fancy brochures. If you actually dig a little deeper as to how that all got approved and how they researched that, it's really scary.
And so, okay, I want to ask you about this, and I want to ask you specifically about Rexalti. But one thing in particular, so I only learned this over the past few years, and I don't know if this is true in every single instance, but from my understanding, when something is like peer reviewed, often what happens is the drug company gets the raw data, and then they send what they want for it to be peer reviewed. It's not like the people who are peer reviewing just get to look at the raw data. Like they get to look at the data that's already been, reviewed or, edited by the pharmaceutical company. Is that your understanding of how things work as well?
Sadly, that is what I've discovered. And I've read a lot of Joel Lexgen's, Dr. Joel Lexgen. I don't know if you're familiar with him, but he does a lot of looking at the pharmaceutical influence in Canada and pharma sponsorship and how they do it. And also Dr. Carl Elliott, who is a bioethicist in Minnesota, and Dr. Arthur Schaefer, who's an ethicist, medical ethicist in Manitoba. Sadly, that is the case.
Yeah, that's absolutely horrifying. And then I also know too a little bit about the Vioxx scandal, and it seemed like they knew, like there was emails that like they shared that like they knew that this drug was going to be very, very
that is
dangerous.
The tip of the iceberg of. I highly recommend you read Dr. Carl Elliott's book on whistleblowers. It's the tip of the research, everything. And when you actually look at who is behind some of this stuff, it's terrifying to find out that the CDC or the Department of Defense or the money's coming from somewhere.
Yeah.
And the patients are just guinea pigs in one big research study.
Yeah, it's
the doctors. The saddest part is, so with Otsuka in particular, let's talk Otsuka, because I'm just, I'm ADD as all get out, and it's my gift. It's not something I would ever medicate. But when I focus in on something, I study it. And so with Otsuka, if we have a pharma paid lobbyist, if we have...
Just explain what Otsuka is first before you...
Otsuka is just one drug company that manufactures Rexalti.
Okay. And where are they based out of?
Japan.
Japan. Okay. Okay, go ahead.
So this is a drug company that the Department of Defense in the US signed a contract in March 2020 at the beginning of the pandemic with this drug company. The contract ends in March of 2025. Okay. So at the beginning of the lockdowns, a contract was signed with a Japanese antipsychotic drug manufacturer. So the money for, once these drugs receive approvals through FDA or through Health Canada, the money to market these drugs in Canada and in the States is limitless. And so the Abilify Maintaina injections, these antipsychotic injections, that's part of a phase 4 clinical research trial, which means 1,000 hospitals in the US and some in Canada are put on this Abilify Maintaina hospital free trial program where they have free product. And this includes usually the veterans hospitals are the ones that will be put on this program. And
why veterans?
Oh, the military, sadly, veterans are often experimented on.
Okay. I mean, that's what I thought, but I just wasn't sure if there was something particular about this drug or something like that. Yeah, if you
look at the malaria studies and there are scandals that have gone on for quite a while. If you look at MK Ultra, that was funded by America in Canada.
I was actually going to bring up MK Ultra, but I wasn't sure if I was going to go too far off, and I won't go there because
no, it's actually exactly what's happening, and what's unbelievable is that the doctors, they don't have time to dig and find all this out like I did. They just go with the flow. The latest drug, the drug rep flies in from Calgary, gives the doctor a fancy brochure, feeds the nurses lunch, explains the benefits of these injections, and off we go. And then everybody's like, oh, but it's Health Canada approved. Well, how did it get Health Canada approved? I've spent an hour with Health Canada and their lawyers trying to figure out how it got Health Canada approved. And they're like, oh, we'll get back to you. But of course, I haven't heard back. Nobody will take responsibility for how things are done.
That's scary. And also, to let people know what the side effects of this drug are and what has happened to some people who have taken it.
Well, this particular drug is very different than other antipsychotics because most antipsychotics are dopamine blockers. This one is a partial dopamine agonist. So it makes people bipolar. It makes people compulsive gambling, sex, shopping. It makes them, it's a side effect of the drug. And, you know, how is a caseworker supposed to recognize that? She's just treating the bipolar, right?
Right.
So nowhere is this the standard of care anywhere else in the world, but yet we're doing an awful lot of that here at my health authority and at Fraser Health, one of the other health authorities. And so when I started looking at how did this even happen, nobody has any answers for me. But the phase 3 trials for Otsuka for Abilify were done on 10-year-old children. Can you imagine that? With and without psychotic features. So I'm digging up these studies going, how on earth did they enroll kids between the ages of 10 to 17 into these phase 3 trials? Who signed the consent? Where are these kids now? Well, they never let you know any of this. So Dr. Schaefer connected me with a number of ethicists.
Why was it even tested on kids though? Usually, not all the time, but usually those drugs are given to adults. They're not given to adolescents. Yeah.
So that's one thing. So yeah, it's problematic. And a lot of drugs, they usually undergo animal testing or something before. None of that happened. And you look at it and you go, holy, it's just, I just couldn't believe it, really. And I have no answers. It's just, I thought, oh my goodness, if this is how drug approvals work, what else are they approving? And I mean, back in the days of Prozac and Zoloft, the term chemical imbalance, remember that? Mm-hmm. Chemical, everybody has a chemical. Well, Joanna Montecrief is a psychiatrist. It's all been disproven. Dr. Paul Minot, Dr. Joseph Witt-During, they're all psychiatrists. So it's not even the scope of my practice. It's the scope of their practice. And they're saying it's all baloney, right?
So yeah, there's a lot going on with the SSRIs. I mean, that paper that you're referring to last year, a lot of people, I think it was last year, maybe it was the year before that came out, that a lot of people have, referred to that paper, and it has, I think, changed some people's perspective, but still the overall, feeling is, it's still a chemical imbalance. It still needs to be treated. And I bet if you looked at, the amount of prescriptions that have come out prior to and after that study, again, I don't know for sure, but I bet it hasn't changed in the last couple of years. It's probably even gotten worse, to some degree.
I think it's gotten a lot worse. And I think we went from, benzos. So now the College of Physicians and Surgeons of Quebec is looking at doctors that are overprescribing benzos, but you can't stop people cold turkey on those drugs, that have been on them for years. And then we went to SSRIs, and now, of course, it's the atypical antipsychotics, and we're way overprescribing them, and it's still going up like this. And 60%, I think, of the prescriptions that I was looking up are written by family doctors. So.
And what do you think about the SSRIs being used in adolescents? Because this wasn't really brought to my attention until maybe a couple months ago. I saw someone write a piece about it, but during your adolescence, that's when you develop, your sexual, drive, and, that's when you start to have relationships and that kind of thing. And so during that time, if people start taking antidepressants, it may actually, not allow them to develop during that time, because it can decrease someone's sex drive so much. They may not even understand or know what it's like to have, a sex drive during their adolescent years. And then they kind of get into their 20s and they just think that it's normal, to basically have a low sex drive. And it's not something that ever really dawned on me until someone, pointed it out recently. But I could see that being, a major issue for people who are put on SSRIs when they're in their adolescence, because we know that it has sexual side effects even as an adult. But I mean, I can't imagine that, it would be, even worse as someone who's taken it as an adolescent.
So because of my undertaking with the College of Physicians and Surgeons of BC, and because I have to practice within the scope of my training and recent experience, I can't really comment on any of this, but I will refer you to Dr. David Healy, who was a professor of psychiatry at University of Toronto. who has written extensively on this topic. And he feels that this group of drugs is probably the biggest mistake we've ever made in medicine. That's his opinion. He's entitled to have an opinion, right?
Right.
He was fired from University of Toronto for his opinions on SSRIs.
Wow, I didn't know that.
And then Lilly came in with money to expand a ward of the hospital, okay? So pharma is dangerous. It's dangerous to have an opinion. And, Nancy Oliveri is another one who had an opinion, and she went after Barry Sherman and Apotek. And that didn't end too well for the Shermans. I don't know who was involved, but these are dirty games. And the other person that has written extensively on SSRIs and discusses them are Dr. Adam Urato, who's a fetal-maternal specialist. And he talks about, we have a lot of young women on SSRIs nowadays, and they can't be just stopped. So oftentimes they may get pregnant while on the SSRI. And there are issues to the development of the baby in the first trimester and being on these medications. So the people to discuss these topics more are Dr. Joseph Witt-During, Dr. Joanna Moncrief, Dr. Adam Urato, Dr. Paul Minot. There's a documentary called Medicating Normal. And
is that on Netflix, or where can you see that?
You can find it on YouTube.
Okay, Medicating.
And another movie coming out not in some time is called Pharma, about the thalidomide babies.
Okay.
And people say, oh yeah, just go sue the drug company or whatever. It's not that easy, and not many lawyers take on class action lawsuits. And when they do, most of the money goes to the law firm. And patients may get a payout. So the thalidomide survivors 50 years later, many have passed away. Some got $10,000 for the inconvenience of a life with no limbs. They're bullies, right? And you're not going to find out the facts because they don't share the facts with anyone. And the whistleblowers within the drug industry don't fare too well. And Dr. Elliott's written extensively on that topic. It never ends well. It ends that they're discredited and they're demoralized. They end up bankrupt without a medical license usually.
Yeah, it's definitely not a good place to be, which is why, a lot of doctors are, very careful about what they say online and that kind of thing. And yeah, with the SSRIs, SSRIs for sure, but with just medicine in general, it's confusing because there are some amazing drugs out there that are just absolutely incredible. There's so many drugs that are incredible. There's so many incredible things that we can do in medicine. As an anesthetist, you saw, all of it, but just like hip replacements and knee replacements, it's insane how much people's quality of life can improve. And sometimes some of these drugs can really improve. But then we have these other ones that are just, absolutely, atrocious, and they can devastate lives. And, there's one statistic that's insane but the third leading cause of death in North America is physicians or iatrogenic drug use or, iatrogenic
and polypharmacy and the prescribing cascades that follow. And the disregard to the potentially lethal drug interactions. And I was talking to one of the intensivists and I said, why is it that we're keeping people on all these different medications? They may be on 2 SSRIs and a benzo, and they may be on 2 antihypertensive drugs, and nobody does a proper medication reconciliation. And he said to me, a lot of times it's because, again, the whole scope of practice thing, you're afraid to challenge the cardiologist, the psychiatrist, the endocrinologist. And before you know it, the patient's on 10 different medications with serious polypharmacy, and it's not very good medicine, but nobody actually sits them down to go through it all. It sometimes happens before elective surgery, where we have in the anesthesia consult clinic, the anesthetist and the pharmacist will go through the medications and try and tell people what they should continue, not continue, etc.
And a lot of people don't know their medicines. Like, they have no idea what they're taking.
The little
for.
blue pill, little yellow pill, right? Yeah.
And so, people have very little, some people just aren't that conscientious about their health, but some people who are conscientious about their health still, just haven't taken, the time to learn the names of the medicines and what they
Mike,
do.
I think that's also how all these injections, these neuroleptic injections started, because it was too complicated. They're on so many medications, right? And, they have 3 different disorders. Why don't we just do a simple injection, right? But the problem is, with any depot drug, there are dose-dependent side effects. There's something called dose dumping. There are lethal drug interactions, and it's not that easy. Nothing is that. It seems easy. Okay, we'll just inject something. But do you remember with the Depo-Provera and women and strokes and high dose hormones? And it's more complicated than that. And so listening.
I had a bad reaction once from a patient who had a depot shot. She had to go to the hospital almost right away.
Look at all the lawsuits with the Mirena IUD with high dose progesterone that's supposed to be localized, but people are getting all sorts of ovarian cysts and tumors and so like I say, I think my advocacy work right now is such that I didn't realize just how much laws are created by politicians. Certain laws created by politicians.
I want to talk to you about it because we were talking about that before the show.
Yeah, and policies are written by administrators and things like that, and managers, right? And some of them don't make any sense anymore, but we've completely stopped any sort of critical thought. And I'll give you another example. So one day, I was a fairly speedy anesthetist, and I was doing my list of total knees and total hips. And so I'm putting in the spinals, and 3:30 rolls around, and the charge nurse comes and says, "Would you mind adding an extra hip to your list?" No problem. We'll probably be done by 4:30, or, fast surgeon. And happens to be my stepson's graduation, so I think, okay, I'll be out of here in time. Well, what happens? We finish the surgery, but now, of course, the recovery room is full because all the patients from all the surgeries of the day are in there. And so there's no nurses because it's shift change, 3:30, so there are no beds. And so we're recovering the patient in the operating room. So the patient's completely fully recovered by 6:30 at night. So I call the ward thinking, why don't we just take the patient who's practically ready to walk home on the new hip to the ward? Well, shift change is happening, or coffee break or something. And they're going to check with their manager because they don't recall that being in their policy manual. So another 15 minutes rolls around. We go through the policy manual. No, Dr. Anna, it's not in the policy to bring the patient directly to the ward bypassing recovery room. Okay? It's stuff like that. We have stopped using any sort of critical thought. In everything is policied, protocols. This is how you do it. In a private practice,
to the point where it just makes access to care way more difficult. And it's already access to care is already difficult, and then you put all these protocols in place, and it makes it even more difficult.
Yeah. And then the people, I'll give you another example. In oncology, they've got all these systems. They've got to open one system and another software system, another software system. So it's going to take twice as long to see a patient because of the technology is not quite user-friendly. But nobody cares. Nobody consults with the people that are actually using the technology, or nobody cares.
I don't understand that. That's one thing where I think that, I didn't mean to interrupt you there, but I just really feel this is an important point. There should be a lot of emphasis right now on EMR and how we can use it to better provide patient care more efficiently. And, right now, and, one of the clinics where I work at, we still use pen and paper because really there hasn't been that many good systems enough come out where a lot of the doctors feel like, you know what, this is actually faster. It's like I have to open this, click there. Like it's like at the end of the day, it's not that much faster, you know?
No, I don't know what system you guys use. We have Cerner, but there's Epic and Cerner. In the States, the same thing. And the discussion right now is, should patients be in control of their data, or should these big government systems control everything? And my feeling is, the more I think about it, patients should have full control of their data. It shouldn't be that the health authority refuses to release your patient records, or that shouldn't happen. Everybody should have full access to their medical records.
I know that right now in Ontario, you can go online and see your blood work like before your appointment, and the same too, I think, with Life Labs, blood work. So same too with whatever the X-ray is that we use in London, like London X-ray or whatever. I think you do have to pay some kind of membership or something for it, but you can go online and see your results, which I think is helpful for some people.
That's the case here as well. Yeah.
But one thing too, just kind of popped into my mind. I didn't really mean to bring this up, but for patients, I think a lot of people are frustrated with they have to go to their doctor to get access to a blood test, whereas sometimes, they'll ask their doctor to order certain blood tests and they won't do it. Like say, for example, like a lot of people have put more weight into ApoB than say LDL for cholesterol, and some people don't put any weight into LDL at all and ApoB, and I get those people, but I still put a little bit of weight into that stuff. So, that's just one example though. Like some doctors just won't order an ApoB, or some guys are, 40 years old. They want to check out their testosterone level. A lot of doctors just won't order that. They don't understand that you also need to order a free testosterone into a total testosterone. I think that's a little bit of, a barrier for people now too, is like not just accessing medical records, but also to just getting access to some like basic blood work that I think that, is within their right to, have if they're so willing to, pay for it and they want it.
I truly believe we have a healthcare system that's neither universal nor easily accessible. And I think it just provides, obviously if you have a trauma or a heart attack, you'll be looked after, but it provides the bare minimum for all of us. And it actually saves money not to operate, right? Saves money not to work. Whereas the American system is, you want to work, you want to generate income. So my first job was actually in Stanford. I never took the job. It was at Lucille Salter Children's Hospital. And I talked to people in America that work in both private and public, like in county hospitals. It's not better. It's not better. America's not better. But if you have money, you're going to get much better care. If you have insurance, boy, oh boy, you're going to get care that's 100 times better. And I think that's the problem is, Dr. Day has fought this now for 20 years. I think I was Mats Tolin, Naomi Kronitz. There were a bunch of people that were anesthesiologists that bought that Canby Clinic facility when Ed Gofton. So there were 5 of them. And, he's fought for access and orthopedic access to private clinics, and it hasn't really gotten anywhere for 20 years. But I think just telling people, you can't pay extra to get if you're curious, this test done. Or, that's just not very good. It feels like the communist system that my parents left in Poland. You cannot do this. No, your mom can't go travel outside of the country because, whatever.
It's treating adults like children, to some degree.
And, yes, there are a lot of charlatans out there. There's in America, especially, they'll try and sell you snake oil and charge a lot of money for it. And they're selling hope and false promise, especially for cancer patients. And you kind of have to read through that. And I'm thinking, that's challenging. And it's very good that we're regulating that a little bit more in Canada. So far, we've done a good job. But if people, the science is moving very quickly. And like you say, with ApoB and if they're curious, or if the doctor is interested, or if the patient is willing to pay a little bit of extra money to find out, why not? Why are we always saying no to everything?
Yeah, I agree. And a lot of people ask for a CRP, which luckily is free here, C-reactive protein test for inflammation. But a lot of people's doctors just won't order it. Like, why? Like, why do you want a CRP?
So I did a bunch of blood work because I just decided, I took one patient and I decided she was a perfect example of absolutely everything that is wrong with our mental health care system. This one lady who's a single mom and has a 13-year-old. And I did her pharmacogenomic testing. I paid for it. I did all her blood work, and her C-reactive protein is through the roof. But they won't stop injecting this drug into her. And they say, we will stop when your daughter's 20. Well, the girl's 13 right now. So I'm just, where are human rights? Where is... I understand perhaps they're doing all of this in order to control homelessness and drug addiction and all this involuntary kind of stuff, but those aren't the people that are caught under these laws. It's usually the eating disorders, the single moms, the kids that are smoking pot. It's not the drug addicted. They're just caught and released back onto the street to cause chaos.
Yeah, it does. The whole system doesn't really seem to make sense. It's like someone can, basically almost like commit a crime and be high and then get sent to the hospital for, repairs if they injured themselves, and then get sent to jail for one night, and then they'll just be back on the street the very next day. And then the exact same thing will happen. Single
parents who made the mistake of involving the Ministry of Children and Family Development, and they're going down this route. I just think with how harassed this woman has been, and how they're so threatening and intimidating and coercive. Why don't they take all those caseworkers to go and do something useful on, East Hastings or Pandora?
And what is the kind of, vibe out there right now in East Hastings and that area? We hear stories, obviously we see, clips and little videos on social media, but, as someone who, is from British Columbia, has lived there, what is it actually like there right now?
So I like to interview people. I'm a big, chatty person. So Loretta at London Drugs says, Anna, you're not going to believe this, but the same people come in and steal those lighters 6 times a day. The same people. Nothing happens. There's no consequence. Or the 80-year-old lady that works at the Hudson Bay downtown, she is in charge of the purses, at the bottom floor where all the fancy purses are, and they're all tied down with wire. But the people come in with wire cutters, and she says, there are a few that are stealing more purses than I sell in a day. The same thing happens with Lululemon. They've moved, but the windows were broken, merchandise was taken, and once they've touched all that stuff, it just gets incinerated.
So there have been, though, establishments like Lululemon and maybe others, I'm presuming, that have had to move because of all the looting?
Yes.
Wow. And do you find that now you avoid certain places that you used to go to?
So I have a son who lives downtown. He thinks it's so much fun downtown. I can't stand going down there. And there's a friend of mine who's gay that lives downtown. He says to me, he's terrified of walking down the street. He's been assaulted 3 times. There are no consequences for the people. The police can't touch them. They can vape and smoke and do whatever, and you're not allowed to touch them. And so, because they're, the poor, vulnerable people, and they're getting administered Narcan. One of the police officers that comes here tells me 8 times a day to the same person. Well, that's expensive. That's like $200 times. Meanwhile, they don't have any Narcan at University of Victoria for a student that needed it. And
so it's $200 a shot though for Narcan. Is that right?
Well, when I was in anesthesia, I know Narcan was you were a crappy anesthetist if you had to give Narcan to wake your patient up. You did something really wrong.
Yeah.
I used Narcan maybe twice in my career because that was don't do that.
And how expensive is it to use?
It was. I believe it was quite expensive. Maybe the prices have gone down, but it's over $100.
That's
so
wild.
If you're doing that 6 times a day to the same guy who's overdosing for fun,
Yeah. I mean, some
There
of
be
these people are costing the system. They got to think like hundreds of thousands of dollars
So
per
one
year.
of the forensic psychiatrists says that a lot of, okay, so I think our budget was $30 billion last year. Where is all that money? Because people don't have health care. But, you know, the homeless and poor vulnerable people, which I understand poor vulnerable people, but a lot of these people are lawless, addicted, and, you know, crime is just on the rise, and there is no consequence to their behavior.
Yeah, like it's not that I don't have compassion for them. It's just that I don't have, I don't agree with the plan. I don't agree with what's being done and how they're being treated. Like and I'm not saying it's easy, and I'm not saying I have all the answers, but I think we just need to attack it differently than the way that we're attacking it now. Go ahead.
And I just wish we weren't so. I don't think healthcare should be a partisan issue. I mean, healthcare, education, come on. The citizens of British Columbia, right? Why can't we just look at all the policies and say, okay, this worked, that didn't work, instead of sticking to some ideology and just not admitting that possibly we made a mistake.
Yeah, that's okay. So that's a really good point. And, I think that there's, a lot of things that have happened over the last few years that have been, horrific. And I don't want to know if I can get too specific into certain things that are happening, but I think there's some children, that are at least being like groomed, in a lot of ways. And all the doctors who are, say, for this, I don't think anything's going to happen to them. There's a PubMed study that came out that said that if if you're older and you want to do it, and I have nothing against these people, but like if you get gender affirming surgery, you're over 12 times more likely to commit suicide. That was a stat. So like, just as a physician, like I don't want to be part of any intervention that's going to increase someone's risk for suicide by 12 times. And the people who, are promoting all this stuff and think it's okay, nothing's ever going to happen to them. Nothing's ever going to happen to them. But if you say, even having this discussion right now is almost, making me feel a little bit uncomfortable. If you say anything at all that like, I don't think this is the right strategy, maybe people should wait at least till they're, 25. I think people don't have all the data right. Like, do they really know about, that having, gender affirming surgery is like, associated with 12 times more likely, attempted suicide. I think I might've said completed suicide earlier, but still obviously a very horrific stat. So, I don't think all that's being laid out for them. And I guarantee you, none of those doctors are going to face any repercussion whatsoever that have, gone along with this. And all the doctors who are, kind of cautioning against this, who, are really going along with the data. And I think that, in years, the data will really, really show, what this is doing and what this isn't. All those doctors, are probably going to get in trouble. So it's like you get in trouble for being right when you're against the narrative. But if you're wrong and you're with the narrative, you're still okay. Right. So it's not really about, being right or being wrong. It's really just kind of more about going along with the current thing, so to speak.
Okay. So I'm going to stick my neck out a little bit. I have a lot of gay patients.
Yeah, that's okay. I'm not talking about gay patients.
No. And I interview them all. And I have a couple of trans patients. And with the 5 kids, of course, they have lots of gay and trans friends.
Yes.
Right? The whole thing of the words that are used, suicide prevention, like they scare parents, right? Everything is like, oh, if you don't do something, we're preventing suicide. Okay. And parents they go down some route, and they're going down this route because of course nobody wants to lose their children. Right.
Right.
So they think we're going down the right route with all of this. And one of the mothers who, has been very open with me, but she's very scared to go public about something. An exceptional counselor in Victoria gave them some advice as a family. They said to the person, because it was such a struggle for a few years, when you're away for this year, make sure you go have sex. Have sex. Have sex with someone that you're attracted to. The person came back and all confusion was cleared up. Because I think what we're not also addressing is that, and people that have had surgery and, gender affirming, and a lot of these things are permanent. Do they discuss rectovaginal fistulas? Do they discuss flaps that have fallen off and are necrotic? Do they discuss the fact that they can never experience the pleasure of sex and intimacy because of the consequences of the surgery? They don't discuss any of that. It's just, the surgery is very final. So, to be doing, I also, when I was researching in Texas, there was the surgeon that showed that how many kids are getting operated on in Texas. I mean, he's fighting for his license and possibly facing a jail sentence because of patient confidentiality. So a lot of these things, the journalists will also report, and who's been very vocal on this topic is J.K. Rowling, and of course the Cass report in the United Kingdom. There seems to be a real push for puberty blocking and this and that. Guess who's behind it all? It's 2 drug companies again.
Which ones?
I'm probably going to get myself in trouble, but if you look up puberty blockers, it's 2 companies.
Okay.
Now, I'll just tell you another thing. Data collection. In 2008, Allergan, now known as AbbVie, started collecting patient data. But it was all voluntary. You could sign up for brilliant distinctions. So you would get your Botox discounts, your Juvederm. Then they included, that was Neutrel breast implants as part of AbbVie or Allergan, cool sculpting, Stericytes, Skin Medica skincare. And the patient would sign up for brilliant distinctions and get reward points for injectables, right? That was in 2008. By 2012, there was a company called the Canadian Consortium for Early Intervention in Psychosis. It was established as a numbered company in Hamilton, Ontario, entirely pharma funded. Entirely funded to push the agenda of injectable depot antipsychotics. And patient data is getting collected, right? And so then, with everything I've discovered, there's this other thing called the Panorama program. Again, you just dial 1-833-EXP-CON and you enroll your patient for $3,000. And that's where the lines are getting blurred now, because before it was voluntary. Now patients' data is being sold to these drug companies and it's involuntary. Patients don't know that they're being... And I guess it's almost unavoidable with technology and how things are going, our data.
Yeah, I mean, it seems like data is very, very valuable, right?
Well, it's extremely valuable because then they know how to market to you. So how did, there's one company called Agence Unique. It's a technology marketing company, a virtual medical education company that started in 2017. And basically they grew from 3 employees to over 60 employees, all because of Pfizer and Otsuka, right? So big pharma and big tech and data and all of it, it's pretty scary.
Yeah, they're all working together, in some ways. And, when they're working together as a machine, it makes it even more difficult to stop, and
virtual podcasts and educational podcasts and all of that. I get that, but technology doesn't have a huge place in healthcare. It really doesn't. I thought it did originally because my kids studied health informatics, and I'm thinking, this is so interesting, And during the pandemic, it was interesting to provide maybe care technologically, but what are you going to really do on a computer? So I know the First Nations Health Authority hired 31 doctors to be virtual doctors of the day, and TELUS is involved, and to provide, healthcare to the First Nations communities virtually. How do you do that? How do you
I'll tell you, I don't like virtual.
you really do that?
I
Other
really
than
don't like it.
overprescribing of antibiotics, overprescribing of everything else. And the only way I can see that possibly helping is if there is actually a doctor on site, a nurse on site, and you've got your expert, your pediatrician online helping make decisions, because it's a complex patient, right?
Yeah, I just don't like it. Like I would rather see patients in person than.
So one of the family doctors, and this was even more continuity of care because it was his own patients. He was in this building. He said, he made almost $100,000 more during the pandemic because of the fee schedule and virtual medicine and telephone consultations. But he said it was so unsatisfying that he closed his practice. He didn't enjoy it at all.
Yeah. I don't enjoy it. Like I don't like talking to patients on the phone.
Yeah. I think if you can't hold a hand, feel a pulse, see if the patient's rigid, look at their movements, really just, are they clammy, not clammy? Like what kind of care is it?
I check people's blood pressure a lot too. I'm really big on controlling blood pressure and heart rate. I really try to get people to get to that 120 over 80 and below 70 if they can, or 70 and below if they can.
Again, the basics of lifestyle and just managing your stress, exercising, eating better. Yeah. No magic solution to anything.
And somehow we've already been talking for an hour, and I know already that I need to have you back on, but I do want to switch gears just for a moment here. So, like I said at the beginning of the show, you're in really good shape yourself. You take care of your health, your skin. I bet that there's a lot of people that are wondering right now, what is your skincare routine, if you're okay with sharing it?
Absolutely. So there's a dermatologist, because again, scope of practice. Is skincare in my scope or not? Don't know. But, I do cosmetic procedures. And Dr. Sandy Scott-Nicky is a very authentic, very straight shooter dermatologist from Toronto, professor of dermatology. She wrote a book called Beyond Soap, The Truth About What You're Doing to Your Skin. So keeping it simple is really important. And I think we talked about, it's not just food, but it's not smoking, not drinking too much because that dehydrates, right? You want to hydrate your skin. You want to sweat. You do want to exercise and sweat. And then there's the whole sunscreen thing. So, oh boy, I've got a long story with that one because I have a tiny little skincare line in my name that's a separate company. It's not my medical company. It's just a separate little venture thing that was done.
Well, I want to know about it. Tell us a little bit about it.
Okay. It has nothing to do, we're not making any great claims that this is the cream you have to use, or basically it's a face wash and a cream. Okay. And the idea behind it is, so read your ingredients. Read the ingredients, read the INCI, and go to an app called the INCI Decoder and just look at all the crap you're putting on your skin. And remember that anytime a product is made with water, like those nice serums or the nice scents, they have to be preserved very heavily. So those department store products that are sitting in boxes for 3 years have methyl isothiazoline, have parabens, have a lot of chemicals in them to keep it from growing molds and fungus, right? And bacteria.
And so when you use sunscreens, you use mineral-based sunscreens?
Always mineral. Okay. So when I studied all of that, there's avobenzone, oxybenzone, homosalate, octinoxate, God knows how many different chemicals. And the way it works, so my mom's a chemist, and we were looking at the structure of all of this, and her grandfather, who actually died in Auschwitz, he was a chemist as well, and made his own cold creams in Poland. And when you look at the chemical structure of some of the sunscreens, the way they work is that they take the energy of the sun, UVA, UVB, and it's an exothermic reaction. That's why it sometimes feels hot. But those chemicals are absorbed. And that's why Hawaii has banned some of the chemicals because they cause damage to the coral reefs, right? So the safest sunscreens are still mineral. People hate the idea of having white on them because zinc can look chalky. And titanium is what creates the tint in sunscreens. So some people, some of the companies have zinc and titanium based sunscreens, and those are the ones that have the tint to them, because titanium comes in different tints, different colors.
If it's micronized, isn't it a little bit easier to put on? Like you won't get as white if it's micronized zinc oxide? As white.
And then there's some, looking at it again, it seems like there might be a little bit more controversy to titanium. So
yeah, I heard a thing. If it's above 20 or 25%, you shouldn't have it above that, is what I heard.
Right.
Anyway,
and so most of the tinted sunscreens have about 3 to 5%. So it's pretty low,
good.
But it has the tint. So then we have our zinc sticks. They're made out of zinc. They're made in Ontario, and very clean ingredients. Okay. Except for those people that are allergic to coconut oil. So minerals, coconut oil, beeswax, jojoba oil, and 20% zinc.
Amazing. I'm going to get that.
These are, well, we sell them,
yeah,
but
I'm going to buy one from you.
We really like these, and surfers love them because you don't have to reapply them every 2 hours, because zinc stays on. It really doesn't wash off. You have to wash it off with soap. And so zinc is it's a physical blocker as opposed
barrier.
To chemical, right?
Yeah.
But the funny thing with Health Canada, okay? So someone reports us. We have like our 3 skincare products. So I've been through so many things since starting all of this, but we get reported for selling drugs. And I'm like, really? What are we selling? That's a drug. And the guy from Health Canada says to me, you are selling sunscreen. And I'm like, oh, well, what about all the other clinics that are selling sunscreen? He says, well, only yours has been reported. So big, long investigation back and forth, lawyers, whatever. Then it goes to the college because we're selling drugs. Because sunscreen now requires a DIN number, which is a drug identification number, not just a natural product number, NPN. It's now a drug, which I understand maybe they're trying to regulate avobenzone, oxybenzone, homosalate, octinoxate, but to regulate minerals as well. Right?
It's just insane and like a waste of time. Like, what are they investing?
An incredible. At the time, I was stressed about it. Now I look back and I think, oh my God, like all the things they need to be looking at they're doing this, right? And so we changed the name from sunscreen to zinc stick. And that was enough to satisfy the requirements of everything. It's now just a natural product, a zinc stick, and not making any claims about, that it offers 50 SPF or 70 SPF or whatever. So the key to healthy skin is not smoking, limiting your alcohol, eating healthy, sweating, and protecting your skin from sunburn. I'm not going to say apply sunscreen every 2 hours because I just don't believe in that. That's like washing your hair twice a day with twice lathering it up and,
Yeah, I totally agree. And I need to sort of do like a solo pod on skin, because I think I confuse people a little bit, because I had, with someone who's like amazing with like the sun. She knows, she was an unbelievable guest, Dr. Alexis Jasmine. So she knew so much about the different, in near infrared light, mid infrared light, and all that kind of stuff. And then my next guest was a dermatologist from Toronto. And so she was, a little more like protective about the sun. But, the way I see it is like, you need to get that sun in your eyes in the morning and on your skin, that really, really helps set the day, helps with your circadian rhythm. Like it's so helpful. I find it anyway. Like I really do notice the days I get it versus the days that I don't. But you got to be careful when it's like super high VU in the UV high, when there's a very high UV index out there. Because when that happens, obviously, you don't want to absorb. It's the overabundance of, UV
anything
rays.
in life. The overabundance of anything in life. It's all about, today my husband calls me and he says, oh, there was this annoying person on a scooter in front of me and she was vaping and she was swerving in traffic. And I'm thinking, you can tell people what they need to do till the cows come home. Like
100%.
You have to do this, blah, 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 and they won't.
100%.
And another thing I've learned in my practice, because I have time to talk to people, I cannot believe the number of people that have had sexual trauma as children.
Yeah, I saw you do a video on that.
Like, it's staggering. It's like 1 in 3 women, 1 in 6 men. And then all of a sudden, because I started discussing it, all these people. And, you know, I can probably get them on podcasts, and they're very respected, very successful men in our community that are telling me all this stuff. And I just wasn't prepared to even process it.
Yeah, it is a lot to take in as someone who's listening as well. You know, there's only so much like of other people's trauma that you can sort of like take in and really have empathy for in a day. Because I think that, you know, that loses, just like with energy, you're going to lose a little bit of that, you know, as you go. But so it is very, very hard work. But that's, you know, it's also a testament to you though, because people wouldn't tell you that if they didn't think that you wouldn't be able to provide them with something. And it also shows that they trust you, because you're not going to tell someone something private if you're not trusting of that person.
Well, you know, it's just I'm in a real privileged position. I have very, very nice people that do trust me, and I am trying to advocate for them, but navigating our healthcare system is extremely challenging.
Challenging.
And, you know, with the whole virtual care thing, I mean, I have a lady who we work with the gynecologist on the first floor, sending people down there, and, you know, whether that's acceptable or not acceptable, I don't even know anymore. But I just know they're getting the help they need. And what they do need is a full-on physical examination. And virtual medicine is not going to solve that.
Yeah, there's definitely a lot of holes out there, but hopefully, you know, the more we kind of talk about it, you know, hopefully more people listen and maybe there'll be some action and some changes. But I know that we've been chatting for, you know, well over an hour now. So in closing, Dr. Anna, is there anything that you want to share? And please, you know, tell people where they can find you online and where they can learn more about you and a little bit more about your clinic and obviously more about that zinc oxide stick that you have.
Mm-hmm. So for me, this is a fun exit plan out of medicine, but I feel I have an awful lot to offer, you know, and I've done a lot of research on longevity medicine. I'm not big into, a lot of people are getting into all sorts of supplements and hormones and injections, and I've not been doing that. I've been trying to show the way of how one can live healthy by creating just better lifestyle habits. And if you look at even diabetes, 95% of diabetes is type 2. So it's highly preventable, right? And my dad is 87, my mom is 82. They're vibrant and healthy and just showing by example.
Yeah. And just to echo what you said there as well, because I did listen to the Dr. Andrew Huberman and Dr. Pia podcast that came out just a week ago or so. And like Dr. Pia said the exact same thing as you. Like he said, like, you know, he does take a few supplements, but he said it's just absolutely nothing compared to like, you know, everything else that's done.
Yeah, I have great respect for Peter Attia, but he and I had a little falling out on social media when I mentioned something about Taylor Swift, and I told him he was a misogynist. And you know what? It's like, again, it's the Huberman and Attia and how much can we lift and whatever. And I'm thinking, you know, we girls are here too, you know.
Well, listen, I think I've had actually 3 females on in a row now. So, you know,
good.
You know,
But Sandy, so as far as like Sandy Scott-Nicky is a dermatologist who really needs to be heard.
Okay. She's in Toronto, you said?
She's in Toronto, yeah.
Okay.
She's fantastic.
Okay.
And obviously, Peter Attia is fantastic. David Sinclair's research is really, really interesting to follow. And so those are some of the people. And then, of course, there are all these critical psychiatrists out there now that are extremely interesting. And they're really making everybody question what's going on. And my favorite's Dr. Joseph Witt-During.
Okay.
And they're all on YouTube and Instagram. And I've never met anybody more authentic speaking the truth.
But Anna, what's your handle on Instagram? You still haven't shared it yet, have you?
Oh, mine's just Dr. Anna MD, I think, but it was restricted for a while. Okay. So I don't know if I'm restricted or not restricted or what I am, you know, like, yeah. Well, anytime you say anything a little bit controversial or a little bit about, you know, critical of pharma, the comments are blocked and removed.
Well,
Yeah.
I think that everyone will appreciate, what you said today, and hopefully in the future, if you do, mention anything controversial, you don't get blocked or it doesn't get removed. So thank you so much again for coming on the show. I really, really appreciate it. And thank you so much again, everyone, for listening. And as always, there's Dr. Anna right now. You can see it right on the screen. It's at Dr. Anna, DRANNAMD. So she's on Instagram. Definitely go follow her. So thank you so much again for coming on, and hopefully we'll be able to do round 2 soon.
Thanks, Mike.